twagala kukwaniriza gwe natulaba. Once more time, it's our another version of Hack Show Be Aware. We are still running our topic of mental health, and today we are looking at mental health treatment and prevention. We want to see today if really someone is going through a mental health disorder, is going through a mental health problem, where exactly can this person get treatment in particular, and also besides the treatment, how can we do the prevention? With me, Mr. Leonard Akida Kamugisha. You are going to welcome the viewers, say hi to them, and then we start from there.
To our viewers, we greet you in the name of God, in the name of Allah, and we welcome you to Be Aware segment of Haki Show. Today, as he told you, we are again here to talk about mental health. We are talking about mental health awareness, and specifically we are looking at where do mental health patients get treatment services.
Yeah. And preferably the prevention part. Yeah. So it's Hack Show Be Aware. Those who haven't subscribed, kindly subscribe, follow, like, and comment. In case you have any question, you have any query, you have anything that you want to inquire, it's Hack Show Be Aware. Just comment, ask your question. We shall create awareness about that. Mr. Akida.
Yes.
You mean I can't go to any clinic to seek medication of mental health?
Before, for the first time viewer who is seeing us, needs to know what mental health is about.
Yes.
When we talk of mental health, we are referring to one's emotional, psychological, and social well-being. If you emotional, psychological, and social well-being.
Yeah.
So if you are not well, if your mental, if your psychological, emotional, and social is not well, then we say that you have mental health disorder. And people who have mental health disorders or who have mental health illnesses are called the mental health patients. So mental health is a special, mental health illnesses or disorders is a special case.
Yes.
That has not been celebrated or recognized, because the majority of the people still look at it as witchcraft, as a curse, but it's a disease.
Which actually people have not paid attention to.
People have not paid attention to it. It is a disease that has got even a special care. You cannot find mental health treatment in any hospital or in any clinic. We have got what we call specialized hospitals.
That was my question. Can they get it anywhere?
You cannot get it anywhere. We have got what we call specialized hospitals, like Butabika is a specialized hospital for psychiatry services or for mental diseases. And then we have got these regional referrals. They have got those departments, and I believe in modern private hospitals, they have also got departments for dealing with psychiatry diseases. Yeah. And then what else can you get? Because not every disease you need to go to Butabika.
Yes, you may not go to Butabika.
We have got like depression, we have got stress. You cannot go to Butabika for that. We have immediate people, immediate places you should go to for treatment. If it is like depression, stress, your girlfriend has dumped you.
You
have got a relationship breakup. You're depressed, you're stressed. Where do you go? There, you will need to go to a counselor.
You need to check with a counselor.
You need to check with a counselor
for guidance
and counseling. Then we have got what we call physiotherapy. Fatigue. Some people have got fatigue.
Yeah.
They have got a kind of stroke. What you need is not going to Butabika. You need a physiotherapy, a physiotherapist.
Yes.
Take you and do those exercises, professional exercises. There you are treating that mental health disorder, other than going to Butabika. But where the situation is severe, then you need to go to specialized hospitals.
Someone may be worried of, we have had some some illnesses
Mm.
that are really costly.
Mm-hmm.
Someone treating cancer may not be a joke.
Mm.
Someone going through an operation may not be a joke.
Mm.
What is an estimated? Is it treating mental health disorder is also quite expensive that someone like may not afford, and ends up going and suffering the effects as a result of the cost.
The costs for mental health, they're quite challenging in Uganda, that we have got a few psychiatrists
That can handle.
at a severe level. We have got very few psychiatrists in Uganda, specialized medical personnel that treat mental health. They are very few in Uganda. So that one alone will make the cost very high and unaffordable to the majority of our citizens. You know, the economy we have in Uganda does not favor everyone. So that one will make it expensive. But at a moderate level, treatment is not expensive. If you're suffering from depression, from stress, and you're going to a counselor, there are some that give free services, free counseling services. Churches have got that, especially the Pentecostal churches. I salute them because they have helped us so much. They are giving free counseling services. Last week I was reading news. I saw Guru Catholic Archdiocese. It was training their local catechists.
I saw.
We're giving them mental health or basic counseling services. So they are doing us a service, and those ones will be giving free service. It is free. There are these mental health organizations. We have like Mindfulness, we have Strong Minds, and others. They have got toll-free numbers. You can even inbox them on their social media pages. You talk to them and they give you free counseling services. So it is the severe levels where the patients will meet relatively higher costs, because we have fewer people who have expertise in dealing or treating such diseases.
All right, if you have just joined us, it's Haksho Be Aware. I personally have Christopher Kasuja as your host, and then Mr. Kamugisha Akida as your mental health specialist, or actually journalist, mental health journalist. Yeah. So here we create awareness about mental health disorder. We looked at the stigma part of it, and now today at the treatment. At that very point, Mr. Akida, there is a statement of prevention is better than cure.
Prevention is better than cure. Yeah.
Before we go to that costness and that nature of where can we get the cure from, how best can we prevent?
How best can we prevent this? It's you started with a very good quotation. You are reading my mind.
Yeah.
Prevention is better than cure. When we are looking at the causes of mental health, we talked about addiction. Drug addiction, alcohol addiction, anger, so on and so forth. So, prevention, we need to practice what we call self-care. Self-care. Exercise, mediate, journaling, do mediation, do enough of exercises. Then, try to stay away from things that will have an effect on your mental well-being or on your mental health. Things like addiction, you can try to avoid
saying that me, I can't do away without this.
Yeah. So if you like, this goes to like artists and these celebrities, don't go for drugs. Don't go for alcohol. Prevent.
Yet I need to chase away shame and that shyness.
You want to chase away the shyness and you perform better. But while you're doing that, remember that your mental health is important. And mental illnesses don't affect only the patients, even their families. When you commit suicide, it is not only you that you have lost. Your family is affected in one way or the other. So before you reach that step, try to avoid things that will drag you into the actions that will likely affect your mental health. Drugs, can say no to drugs. There are campaigns that are always going on, creating awareness, sensitizing people how they can avoid drugs. So before they come to you, try to do what? Avoid such things.
Yes.
You can live without alcohol. You can perform without alcohol. You can perform without being high on drugs. And then we have stress management. How do you manage your stress?
Stress management.
Stress management is a skill. Don't be too angry. The Bible and the Quran says that if you're angry, the sun should not set when you're still angry. That is stress management. The Bible was teaching about stress management. The Quran was teaching about stress management. Don't be over angry. Try to do what? To do what we call emotional balance. And then two, build the social connections and support.
To be with people.
Be with people. Have your confidence. Know if I have a problem, I will go to Mr. Kasuja. Share with him. He can give me an advice. Know if I have this challenge, I can speak to my pastor, I can speak to my priest, I can speak to my counselor. Some families have now employed family counselors. I will call a counselor, he will guide me. I will go to my teacher, he will guide me. And then watch, the most things you consume in the media are also important. Always we had about 2 years ago, we had an incident in Mukono. This young boy was watching television. He watched these action movies, saw someone, and then he wanted to imitate what he saw on the TV.
To put it into practice.
And the boy died. So you also needed to start consuming content on the media that is educational and that creates awareness.
All right. So you who haven't subscribed and you're there, please kindly subscribe. You're missing some sensitization, some awareness, some information regarding mental health. You would be one of them. You would have someone, a neighbor, friend that is going through mental health disorder, mental health problem, but you may not know how to help the person out. Here we are at Hackisho Be Aware. It's the only show where you'll find sensitization, enough information regarding on how best you can treat, handle stigma, and also avoid things related to mental health. At that very point, Mr. Akida, what remark can we conclude with today's show regarding treatment and prevention?
Regarding treatment and prevention, our viewers, it might be you, it might be your friend. Treatment is available at whatever level, whether it is the low level, optimal, whether it is moderate, or whether it is severe. What you need to do, make use of the people around you. The counselors are available. Very many giving free counseling services. Then prevention is better than cure, as we said. Try to make sure that you are away, you stay away from things that will have a lasting effect on your mental health. Don't avoid addictions. Don't be addictive. Seek for assistance. Speak out. Don't die in silence. Now, what kills people most is that they do not speak out.
They want to reserve that.
They want to reserve it with themselves, and they end up dying. But once you speak out, then you are going to get helped.
Thank you very much. It has been Hackisho Be Aware, and it is every Tuesday that we come and then create awareness with you. We want to request you is that subscribe, share to a friend, share to a neighbor, share to everyone, and most importantly, it's Hackisho Yugi. All those ones who are following us on our different social media handles, you're doing great. We can't stop and we can't get tired. We can't get enough from appreciating every effort everyone is doing to see that we move forward. Thank you for everything. Until we meet next time. Thank you.